Evidence-Based Practice in Healthcare, Module 2, Formulating a Clinical Question and PICO. Content by Sally Kamai and Bridget Lai. Formulating a clinical question is an important component of EBP. Once your triggers and topics are identified, one of the next steps is identifying what your clinical question is and what are all of the elements of the clinical question. In order to do this, we need to understand what is the trigger and the topic, and what do we want to improve. An example of a question that you may be asking, a burning question that you've started down the EBP path for, is, right now we have patients walk 12 hours after surgery. Is there a better way? Another example is, we take vital signs every hour on patients after surgery. Does that make sense? Once you have a topic in mind, when looking at formulating a clinical question, we want to examine 4 key components of the PICO: patient, population or problem, intervention or treatment, comparison or control, and outcome. The P, patient, population or problem, refers to relevant factors that determine what is impacted by your clinical question. Examples include gender, potentially age, race, a particular disease like CHF, or even place or location. So it may be all patients over 65 admitted to the emergency room, or it could be all females between the ages of 15 and 40, or all patients located on the pediatric oncology unit. In describing the P, or patient, population, or problem, using words such as in or for, like for patients with Bell's palsy, is typically a good way to phrase the beginning of your PICO statement. The I is the intervention, or also known sometimes as the treatment, but this is what you're going to do to potentially have a better outcome. The intervention may be a medicine, a treatment, a procedure, or a process. This answers the question does or is. For example, if the intervention were healing touch, the question it's answering would be, does healing touch improve patient pain perception? The intervention is based on what you find in the literature, plus your own expert opinion and nursing experience. It's important not to rush to identify your intervention until you've reviewed the research and synthesized it. The C in PICO stands for control or comparison. This is the alternative you want to compare with your intervention. In most cases, this is the status quo or current practice. It may be placebo, it may be a standard of care, or it may be a different medication or procedure. In this sample statement or question, is chicken soup as effective as bed rest in treating a cold? The control is bed rest, and the intervention is chicken soup. Can you tell what the outcome is? The outcome is effective treatment of a cold, and the P, which is missing, is potentially patients who have a cold, although that could certainly be narrowed by age group, by location, or something more specific to help identify the P. The O stands for outcome. Outcome is the desired effect of the intervention. In outcomes, you may use words such as relieve, reduce, eliminate, prevent, or improve. Some examples include reduce bacteria on hands, shorten length of stay, prevent stroke, or decrease perception of pain. These may all be desired outcomes in a PICO statement. In building a PICO statement, again, you need to first identify your triggers, your topic, and then ask, what are you trying to find out? So the sample here is, what is the best evidence-based practice for reducing environmental noise on a hospital unit? That's the general statement. So in this particular case, the P is actually a problem. It's noise on the hospital unit. The I, or intervention, is changes that you would implement based on recommendations in the literature, as well as synthesis of how to apply that to your current setting and the culture of that particular hospital unit. The C is compared to the status quo, or how things are now. And the desired outcome is less noise on units, leading to improved rest for patients. This is a sample of a PICO worksheet used in several EBP courses that simply allows you to break down the P, the I, the C, and the O, and then form them into your question. Here are some examples of clinical questions that have some of the PICO elements present. What are the evidence-based methods to decrease alarm fatigue in adult telemetry units? Based on this statement, we know that the outcome is decreasing alarm fatigue. And the P is our population. Those are staff members in adult telemetry units. What we don't know here are the I and the C. So the interventions, which would be evidence-based properties determined by literature, and the C, which is the current practice. Here's another clinical question. Let's see if we can find all four components. What is the best practice for adult patients on the 4th floor to increase recognition of signs of deterioration using a structured muse compared to current methods of recognition in order to prevent the need for critical interventions or code blue with patients? In this particular example, the P is clearly identified and very specific: adult patients on the 4th floor. The desired outcome is prevention of the need for critical interventions such as code blue. The intervention is use of a structured system, muse scoring system, compared with current methods. Current methods being the status quo or current practice. In the next clinical question, will a formalized RN to NA report increase communication and satisfaction with the report process between RNs and nurse aides, therefore leading to an improved patient care and satisfaction? The P is patients on a particular unit potentially. The I is a formalized report between RNs and nurse aides. The C is the status quo or current practice, which is the current practice of RN to nurse aide reporting. And the desired outcome is improved patient care and satisfaction. The next clinical question: what is the best practice to prevent the spread of methicillin-resistant Staphylococcus aureus or MRSA infection in the adult medical surgical unit? The P is patients in the adult medical surgical unit. The intervention is not yet identified but would be pulled from literature. The C is current practice. And the desired outcome is prevention in the spread of MRSA. The next clinical question is, what are the best evidence-based methods to reduce environmental noise in hospital inpatient units as compared to current practice in order to provide more rest for patients? So in this particular statement, the P, again, could be patient or problem. So the problem may be the noise level in patient units. The intervention would be evidence-based methods identified by literature. The control would be current practice, and the desired outcome is providing more rest for patients. So let's walk through one together. In this particular scenario, a 5-year-old Asian American female child in an office is seen in an office for acute otitis media. Sometimes these infections do go away on their own, and sometimes they seem to need antibiotics. The patient's mother is wondering if antibiotics are really necessary. In this particular instance, in examining this clinical question, the P is pediatric patients with otitis media. The I, or intervention, is antibiotics. The C, or control, would be no antibiotics. And the outcome would be resolution of otitis media in a short time frame. The third example, a project to increase early recognition and signs and symptoms of deterioration in patients on a telemetry unit. The P is patients on a telemetry unit. The intervention would be determined by the literature. The C would be the current status or current practice. And the desired outcome would be an increase in early recognition of signs and symptoms of deterioration. Again, this could be more clearly clarified as far as how this would be measured. It might be the number of code blues called versus the number of rapid responses called. The last example on this slide is a project to decrease the level of stress in staff on a burn unit. In this particular case, the P, or population, is the staff on the burn unit. The I, or intervention, would be determined by the literature. The C, or control, would be the current practice. And the desired outcome, or the O, would be a decreased level of stress in staff. Knowing and understanding the elements of PICO and relationship to clinical questions is an important part of EBP. Have fun practicing.